The non-governmental organization Rhiza Babuyile is working to dispel the misconception that cancer only affects white people. This as the Cervical Cancer Awareness Month just wrapped up, but awareness continues as concerns around the disease remain high. Women from age 30 are being urged to get pap smears and girls aged 10 and older to get the HPV vaccine. According to Rhiza Babuyile's research, COVID-19 pandemic has put women at higher risk of developing cervical cancer due to its impact on primary health care, appropriate prevention and screening. Well, to talk to us a little bit more about this, we're now joined via Zoom by Katlego Assis, who's the Special Project Manager at Rhiza Babuyile. Thank you so much for joining us and welcome to the program. All right, so if you could just unmute yourself, can you hear us now?
Oh, I can. Sorry for that. Thank you for having me. Good afternoon.
No problem. I know that Cervical Cancer Awareness Month has just concluded, but I guess this is a journey that needs to be taken and talked about throughout the year. Let's start with some of the misconceptions that you've come across, that you've had to dispel.
Well, the most one that is very common is cancer, not necessarily affecting Black people. And I think it's a misconception that is just a result of misinformation or lack of information. And what we are trying to do with that misconception is add information so that people are aware that actually this type of cancer, specifically cervical cancer, is predominantly found in communities of low income to medium income communities, and is the second most prevalent cancer within developing countries. So a lot more information is what would dispel that misconception, as well as that it's a disease that is possibly related to HIV, or it's a result of HIV and so forth. So we have to do a lot of sexual reproductive health or reproductive health in general. So those are the two common misconceptions that we found in our research.
So what can be done to try and mitigate, to reduce the numbers? And I guess early detection is always going to be first prize.
Yes, definitely. I mean, prevention is the preferred choice of fighting this disease, because it's something that does not have to happen. And as you said, early detection is possibly the first prize. And the reason for that is that once it is early detected, then you don't have to use advanced form of treatments or evasive forms of treatment. It actually can be treated, but if untreated, it will lead to death. So yes, that's what we are trying to do. And another preventative measure is obviously the vaccine, which you spoke of. Girls from the age to 10 and upwards getting vaccinated. That's another way of prevention, not necessarily waiting for the cancer to show up and then waiting for the early detection. So definitely prevention is better than even before we get to the place of the early detection.
So this vaccine, this has been out for a while now, hasn't it? And it's been proved to work effectively.
Yes, it has been out for a while and it has been proved to work effectively. It's popular, or let me say it is offered within government schools, but not private schools. But parents do have to give consent to children. So I think the lack of information around the vaccine within itself is also an opportunity for us, because I think not understanding or knowing more about the vaccine then leads to an approach that does not encourage it. But I think if we are to bring a lot more education around that, then it will be easier for parents to then give consent. But the vaccine is available and it is free within government schools, but not in private schools. So the government does support prevention, and especially for as we indicated, for girls who are 10 years and older.
Up to what age are you encouraged to take this vaccine?
Until the age of 30. But after that, I'm not quite sure if then it is necessary. But between the ages of 10 and 30, you're encouraged to take the vaccine.
All right, so tell us a little bit more about what causes cervical cancer.
Well, the causes of cervical cancer are linked to a lot of HPV. It's a virus called human papilloma virus. And that virus is the one that causes the cancer that you then find. It's also linked to a lot of sexually transmitted diseases. That can be the cause, but it's not necessarily that. So the HPV virus is the main cause of the cancer, and as indicated, that early detection is something that can then be resolved quite easily, or rather, let me say, be resolved not necessarily easily, and it can be that it then leads to us not having to resort to more evasive and advanced treatments. So the main cause of the virus, of the cancer, is the HPV virus.
Talk to us about screening. What is that process, and from what age should you be going to have the screening processes done?
The screening process is a pap smear process that is encouraged for all women to take. From the ages of 30, it's encouraged that you take it once a year. But for women who are infected with the HIV virus, that should be done every year. And for women without the HIV virus, let me correct that, every 5 years. And the misconception around a pap smear is that it's often done as part of after giving birth, part of your treatment after giving birth, but it's really not. Pap smears should be a part of every woman's life in taking care of your general health and reproductive system. So it's something that that's how you then get to detect the virus very early. So that is the treatment and the screening that takes place. We currently had a drive at RB for 50 women in the community, and a few at least were detected early and were referred to for further consultation. So that was a good thing that we were able to do for the community.
Katlego, I wish we could speak a little bit more, but perhaps these are conversations we should be having a little bit more regularly. But thanks so much indeed for joining us today.
Thank you for having me.